COVID-19 recommendations in our letter of for health equity around COVID-19. Next slide, please. Thank you so much for your time today, and thank you so much for attending the meeting. I look forward to our speakers that are coming up, and I will log off here. Thank you.
Awesome, thanks, Mac. And I think I speak for the entire LHCC leadership team, as well as our local and regional leaders, and especially the LHCC Summit planning team when I say that we're really thankful for your leadership on everything that we've been accomplishing. So now it's my pleasure to introduce our keynote speaker, Calvin Gladney. Calvin Gladney is just an awesome guy that we met at the CPEC Smart Growth Summit in 2019. He is the president and CEO of Smart Growth America and is a nationally recognized thought leader on the equitable and sustainable revitalization of communities, which is a very important role that we play in the LHCC. So Calvin, you want to jump into it? Go for it. If you can. Calvin, are you there?
Hello, everybody.
There he is.
Hopefully now you can hear me. I've been trying to grow up my beard to keep up with John, but apparently I'm falling far, far short. So just want to thank John and others for bringing me out today and allowing me to say some remarks. And it's good to follow Mac's words, because we're gonna spend some time and bring it today, and hopefully we can make sure everything's comfortable. But you know, as a good friend once told me, and actually John just said, sometimes the growth is in being uncomfortable. And so we're going to spend some time keeping it real, talking about today's events, and really kind of bringing things. So I'm going to share my screen actually, so I can use the PowerPoint. Hopefully this will work. There you go. Hopefully everybody can see that. And so we're gonna talk about just the idea of ending being nice and ending not talking, and you know, Max sort of set it all up, really talking about the intersection of race, public health, and equity, and talking about how we actually have gotten here and what we can do to get away from here. Again, I thank everybody for being here today. You know, I know there's a lot of tough things going on, and everyone's both personally and professionally trying to navigate essentially a crisis in the middle of a pandemic, in the middle of your everyday lives. So I thank you for taking the time to listen, and hopefully these remarks will spark some thought and spark some conversation, and hopefully we'll have some time for maybe Q&A, things will be in the chat and the like. So let's dive in. Just in case folks don't know Smart Growth America, our North Star is we envision a country where no matter where you live or who you are, you can enjoy living in a place that's healthy, prosperous, and resilient. And you notice our North Star, the reason we exist and everything we're fighting for, includes an outcome that talks about health, talks about people and places being healthy. So it's great for me to be here today because your goals and our goals really align, and health as an outcome is something that we need to talk more about. You may be familiar with Smart Growth America, but sometimes you might know some of our constituent teams as well. So you might be familiar with the National Complete Streets Coalition, our Locus group of responsible investors and developers, our group Transportation for America is another. So just wanted to let you know that we're sort of a family of organizations. And so you may have interacted with some of the other organizations in addition to Smart Growth itself. What we're here to talk about today, and what I wanted to talk to you about, is this, and Matt kind of set it up, the sort of vicious negative cycle of issues of public health, race, and equity. And it's a negative cycle because it's not just public health, but it's public health disparities and very negative outcomes. And you can particularly see those outcomes in communities of color, African-American communities, even maybe more disproportionately. And so I wanted to sort of talk about this cycle and bring it into full focus on how it relates to what we're hearing about in terms of COVID-19. And in doing that, I really want to do kind of three things as we sort of look at these disparities on the screen. One is I want to talk about people's assumptions about why these things are happening. And you can see the sort of state of Louisiana numbers there, but you can sort of see some other sort of key areas as well. I want to talk about, when you hear about the assumptions, what they're leaving out and why these intersections are happening and why those assumptions are wrong. And then finally, quickly talk about what we can do to kind of break this cycle and move things forward. And it's unfortunate, and these are tragedies, these are just numbers on the screen, but these are actually real people, real lives, and real communities. And you could do this, you could do a slide like this in terms of the Hispanic or Latinx community. You could do this in terms of the indigenous community where we don't have as good or data. So it's a serious problem, and we really need to bring some serious solutions to bear. I wanted to share this picture with you, and many of you may have seen. I'd probably ask you to raise your hand if you saw this in real time in April. This is our current African-American Surgeon General speaking in front of President Trump and talking about the COVID-19 crisis and the disparities that we were seeing. And this is, to me, a perfect example and illustrative of the type of assumptions people make. And it's sad to see when you see a national leader who's supposed to be a subject matter expert on these topics say what he said. And so he said, well, African-American community, you should avoid alcohol, tobacco, and drugs, and that would really help you not have these disparities in terms of COVID-19 hospitalizations and deaths. And then he went further and even said, you know, and do it for your abuela, do it for your granddaddy, do it for Big Mama, and do it for your pop-pop. And it really was one of those moments where I was cursing at the screen because it was clearly inauthentic, but even more importantly, because you know what? Folks don't really say things like Big Mama and pop-pop in the way that he said it. But secondly, and even more importantly, he was talking about this cycle of public health disparities, COVID-19 disparities, race and equity, and he was playing the blame game. He was saying, well, these results are a function of individual actions. It's a function of decisions that these individuals, that these communities, African-American communities he called out in particular, that it's these decisions and this is how we're getting here. And he's just flat out wrong. And it's just sad to see a national leader, and frankly, a national African-American male leader make that, both those assumptions, but state that as something that is true. So just wanted to flag that as an issue. And now let's kind of talk about what's really true. This cycle is not a function of people's individual decisions, and if they were just better actors and made better decisions, these outcomes and these disparities wouldn't be here. This cycle is intersectional, it's interdisciplinary, and it's systemic. It's a function of a system that is churning out the outcomes that the system is built to churn out. So this is not a failure of the system, you might hear people say. This is actually what the system is built and designed to do. And these issues are intersectional. So you can't just talk about one particular part of the issue and say, if we solve that, then the crisis and the disparities will go away. You have to come up with intersectional and interdisciplinary solutions to kind of get to these problems. And so I want to talk a little bit about some of those intersections that I think will be relevant to you. The first is, it's not just public health, COVID-19, race and equity. It also includes transportation in our transportation system. Intersectional. So let's just dive into transportation and get into that level of detail. So you could see on the screen that the transportation sector in our system is the highest emitter of gas emissions in the country. And this is from the EPA. And so that has climate change implications that we're not going to focus on now. But that transportation system actually has direct public health implications. And frankly, too, if we drill it down a little bit more, implications for these disparities in terms of hospitalizations and unfortunately deaths when it comes to COVID-19. And let's walk through that really quickly. This is a CDC study, and you can Google this and find this, where they say members of minority groups experience higher exposure to traffic-related air pollution. So you have the transportation system, which is the highest emitter of greenhouse gas emissions, and frankly, it's traffic and traffic-related air pollution that's disproportionately affecting minority groups. And you got to start saying, well, what does that mean and why is that relevant? And you can just drill down and you can take this city to city, but just quickly, this shows that this is not, again, the system is designed to churn out these results. And this is just a drill down in the city of Seattle, where it talks about the worst air quality areas are in communities of color. And it's not just any communities of color, it's LMI or lower income communities. So this is a system, this is the structure, and we don't get to these outcomes by accident. And it relates back to COVID-19. And I don't know if you just saw, this came out just about 3 weeks ago. This was a Harvard School of Public Health study that showed that exposure to pollution reduces the survival rate of individuals with COVID-19. Said differently and more dramatically, more people die if they have more long-standing exposure to air pollution. So if we went back 2 slides and say, members of minority communities and communities of color experience higher exposure to traffic-related air pollution, and that the transportation system alone is the one that's churning out a lot of this greenhouse gases, which also translates to pollution, you can see how that gets us to these COVID-19 disparities. African-American communities, in specific and particular, and Hispanic, Latinx communities, and indigenous communities are suffering from the built environment and transportation system, which basically sits air pollution on top of their communities. And as you know, and actually there's issues in Louisiana now where highways being built through these same communities. So it's these communities of color that have the air pollution based on our transportation system that is directly reducing their survival rates. Frankly, it's causing more of us to die. And so you can really see how it's not a set of assumptions about individual decisions. There's a structural, systemic transportation system level to these disparities in public health, and particularly COVID-19 deaths that we see. And it doesn't just stop there. The transportation system also applies to who works for the transportation system. As you can see on this slide, 50% of all transit operators are non-white. So not only do you have a transportation system and structure where communities of color have air pollution and other pollutants that sit on their communities, and that's putting aside having longer commutes and all the negative health outcomes that we can talk about in terms of obesity, health disease, hypertension, cancer, and the like, but also a disproportionate amount of communities of color are those bus drivers and transit operators who are frankly on the front lines of the COVID-19 pandemic and suffering more deaths because of that too. So again, the transportation system and how we fund it, so if we're not funding PPE for transportation systems and particularly public transit systems, then that's going to disproportionately affect the folks who are the transportation workers, who are the transit operators, and those folks are disproportionately non-white, particularly African-American and Hispanic. So you can see how this transportation system, not individual decisions, are really leading us to these public health outcomes and specifically leading us to these negative COVID-19 outcomes. But I said it's intersectional, meaning it's not just one thing. So it's not just the transportation system. We can also talk about land use and housing and how this cycle of race and equity and public health disparities are really leading us to these outcomes. And as it was said before, I've put race on the screen, but it really is racism. And it's specific decisions that we've made about our transportation system, our built environment, about land use and housing that were based on race, based in racism, and frankly, in many cases, based on fundamental principles of white supremacy that really lead us to this place. And so we cannot solve these problems. We can't get out of these public health disparities. We can't break this cycle without, as Mac said in the very beginning, naming racism and intersections of race as part of the problem. That's the only way to get to the solution. So I wanted to quickly talk to you about land use and housing as another systemic level issue that gets us out of this Surgeon General concocted theory of individual actions, and just show you another way how the system, the structure is leading us there. So wanted to just give a little bit of Louisiana detail, and this talks about how 160,000 people living in the state of Louisiana are especially vulnerable to extreme heat. And I'm going to lead you through how extreme heat in our land use and zoning and built environment decisions get you back to these public health disparities. And one thing you might know based on where you work is extreme heat has actually a definitive effect on high blood pressure, on hypertension, on heart disease, and some of the other comorbidities, social, socially based diseases that we see. Extreme health relates to that. And that all relates to race-based decisions we made in our built environment. And I want to talk about that a little bit. So this is a map, and this was done by a friend of mine, Jerry Hoffman, at the Science Museum of Virginia. And what they did was they created a map of the city of Richmond, which is a majority African-American city in Virginia, but you can do maps like this around the country. And they said, where are places where there's much more kind of urban heat highland effects, and basically the communities that live in those areas suffer from this sort of pooling of urban heat for a variety of reasons, and therefore have these extreme heat conditions. So they mapped this visual out, and they said, well, how did this happen, and how does this urban heat vulnerability relate to the built environment? And so they thought about, and I don't know how many of you can sort of raise your hand in the chat box whether you've ever read this book, and if you haven't, you should, called The Color of Law. And it's by Richard Rothstein, and it's actually funny because the last presentation I did in person was in Austin, Texas, and Richard and I sort of did back-to-back keynote speeches, and I think Richard Rothstein is the last person who I actually shook hands with before the pandemic broke out, because I literally traveled to Austin just before they canceled South by Southwest. So just as a random side note, and if you wanted to see a picture of me and Richard, you could go to my Instagram or Twitter, Smart Growth CEO. Maybe you're talking about me right now, and you could see pictures of that talk. So this book, The Color of Law, talks about how zoning and built environment decisions that were race-based and racism-based led us to the situations that we have now, the zoning, the race-based decisions, and that built environment. And in that book, they had these maps. And this is this map of the city of Richmond, which talked about this concept of redlining and how African Americans and particularly Hispanic Americans were funneled to only certain neighborhoods. Basically, the federal government would only insure mortgages that went to certain neighborhoods for certain racial groups. And so if you were in one group, they basically created these maps around the country, and some of you have seen these maps in the book, which basically said, if you're in these red areas, we're not going to insure those areas. And those are actually the areas where typically African Americans and Hispanics lived. And then the other areas, the areas in yellow and blue and green, are the places where the federal government would back those mortgages, which basically meant that, in effect, African Americans and Hispanics could only buy houses in these redlined areas, and white Americans could buy in these other areas, which ultimately got a lot more investment. And you can see disparities in wealth building that really started from this structural race-based set of decisions that are talked about in this book, The Color of Law. So let me bring that back to heat, though. And so I showed you this map of urban heat vulnerability. and I showed you the redlining map. And it's sort of like, well, do I see any correlations? Well, actually, I'll let you soak that in for a second. If you look at on the right side of the screen, maybe your left side, depending on how you're sitting, if you look on the right side of the screen, which shows the race-based decisions and the redlining that caused African Americans and Hispanics around the country to only be able to locate in certain areas, you see an almost scary alignment of the places where extreme heat is a real issue for those communities. And that is by no accident. And that's, again, going back to by design. And so when you see, and we talk about extreme heat causing lots of issues, then this is a design of the system. How does that relate to our public health outcomes in COVID-19? Well, just to use a Baton Rouge example, this talks about how hotter temperatures cause more air pollution. So if we go back to that public health study that I just talked about that said exposure to air pollution causes more deaths of individuals with COVID-19, and we know that hotter air causes more air pollution, and it's communities of color and African American and Hispanic communities by design, by system, were forced to these areas that now have the hotter temperatures that cause more air pollution, and that air pollution, both because of our transportation systems and our built environment and the race-based decisions that were made, lead to those COVID-19 disparities. So we got to get out of this discussion of individual decisions are causing this and ignore the history and ignore the race-based decisions that have gotten there. And it's intersectional because I just talked to you about not just transportation system decisions, but also housing and land use. So we have to come up with solutions that talk about all those issues and not just one or the other. As a matter of fact, we can't solve public health issues without solving these issues that relate to all of the different things that go together. So just wanted to keep moving with this discussion. So overall, that gets you to that this system is intersectional, it's systemic. It's not based on individual decisions. These public health disparities, these COVID-19 disparities, whether you talk about the type of sickness, the level of sickness, you talk about hospitalizations, we talk about death rates, we talk about obesity, we talk about hypertension, we talk about cancer, we talk about diabetes. These relate to the system. And I know we talked earlier about how a lot of this coalition's work talks about food systems. So it's no coincidence that these same neighborhoods are food deserts. So now you layer in the food systems and you say we have a transportation system that churns out public health outcomes and creates additional risk vis-a-vis a pandemic like COVID-19. We see a history of land use and zoning and housing finance and mortgages and redlining, and it leads us to these public health disparities, these public health outcomes. And it's all based on history, and it's based on a system that's still in place today that still has these race-based outcomes and frankly still has the tinge, the veneer, the actual intentionality of racism built in. It's no accident we're here. It's intersectional, it's systemic, and we have to come up with solutions that think intersectionally and think systemically and that fight at a systems level if we want to get out of these public health outcomes. So I talked about the assumptions. I talked about what they're leaving out, the idea that it's intersectional and systemic. What can we do? What can we do? And considering, like I said, in some ways, you could draw a circle, say, we're in the middle of a crisis that's, you could call it, and I didn't coin this, but racism 20. And that circle, you draw that racism 20, and then you can draw a circle around that and say, that's within a pandemic that's COVID-19. You see what I did there? And you say, well, how do we deal with a crisis built within a pandemic, which is built within a system, institutional, historic, and built to churn out public health outcomes that are bad? How do we deal with that? Well, let's talk about those things. And I'm going to give you kind of 3 ways. I want us to go big. I don't want us to think small. I want us to keep equity front and center. And then finally, I want us, again, have intersectional things that we ask for, intersectional advocacy and solutions. And then we'll kind of wrap it up. First and foremost, no more public health nice. So, you know, this is a play on the idea of Midwestern nice, but in many cases, and I got this phrase from John O'Donnell, the idea of public health nice is we're thinking about, well, how do we talk about these public health outcomes and not name race and racism and the institutional system that is churns out these type of outcomes. If we continue to dance around the race-based outcomes here, if we continue to dance around these issues, we can't get to real solutions. We can't create a all boats rise set of solutions and say, well, once we create an all boats rise solution that gets to public health disparities, ultimately the African-American community, the Hispanic community, the Latinx community, the indigenous communities, low and moderate income communities, they'll benefit. Their votes will also rise. That's just not true. We can no longer be nice. We need race-specific solutions to fix race and racism-created problems. So no more public health nice. And we couldn't do that, and you see that. We weren't trying to be nice when we realized that we still can't breathe, and we saw a video, and you can see how not being nice and doing things the harder way and doing some things that, you know, don't always have the nicest results, like protests and the like, ended up moving the needle forward. So we just can't be nice any longer. Secondly, we got to keep equity front and center. So I talk about being intersectional, and you know, what does that really mean? And part of what that means is to say, when you think about issues of equity and you're thinking about how to undo public health disparities that really have too much alignment with race and class and ethnicity, and the intersection of those, then you have to say, when we come up with solutions, we can't just be public. You no longer are public health professionals. I'm going to put my hands over you right now like a preacher and say, you are no longer public health professionals. You are intersectional, interdisciplinary professionals whose goal is to change these public health disparities. But you can no longer be a public health official. You need to be a transportation professional. You need to be someone who works on and thinks about the built environment, because those things are the upstream issues and the upstream challenges and the upstream system level problems that are causing the public health disparities that you're trying to fix. And so you gotta bone up, partner with organizations like mine to do some advocacy, to work on studies and research that can show these issues. We gotta work together, and we can't be in a public health silo, and we have to have equity front and center, and we have to think about it in an interdisciplinary way. And then finally, and this is what is happening now, I want to tell you a really quick story that talks about the idea of going big. And if we were here, if we were together, I'd say, does anybody here, I'd raise my hand and say, does anybody here, and answer in the chat, by the way, does anybody recognize this picture on the screen? This is a pretty spectacular fire that was happening on the banks of a river many years ago. Anybody in the chat recognize this particular picture? I see, let's see, anybody know the answer? I see somebody say Cleveland, and the answer is, yes, 1969, right after the Martin Luther King Jr. Assassination-based riots. This is the Cuyahoga River in Cleveland, one of the main rivers. It's a city where a river runs through it. And there was a spectacular fire that was actually based on, going back to air pollution, based on essentially all of the illegal and sort of sanctioned dumping that was happening on that river, primarily, coincidentally, mostly automobiles, tires, and car-related and transportation system-related illegal dumping actually resulted in this massive fire. And so how does that relate to what we're doing? Well, one of the things that happened from this fire is people said enough, that we have to become advocates in the middle of this crisis, and we're going to partner with organizations that focus on federal advocacy. We're going to think big and fight for systems level change. So if you look at these things, this is where the Environmental Policy Act came from. This is where the Federal Clean Air Act came from. This is where we talked about in an interdisciplinary way. So you notice these legislative wins, this advocacy happened on a federal level and a state level, but it also said we can't just deal with water. We have to deal with water, air, substances. We need to create a new agency that can focus on this in a correlated and comprehensive way. And this is what I implore you to do with these public health issues. We no longer can say, well, let's just go fight on federal public health things. We need to go out there and now, particularly in the middle of a crisis wrapped in a pandemic, and we need to go big. We can't have small plans. What we need to do, and use the words of Daniel Burnham, the famous architect who said this once ago, we can no longer make little plans. They have no magic to stir a man's blood. And so what we need to do right now is we need to say, what are those big ideas? What are those system level changes that we can make upstream that then can turn into the type of things, going back to the original presentation from Mac, and talk about how do we change the inputs, and the outputs will cover themselves. But we got to think system level inputs. And that's going to require a fight at the federal level and national advocacy and studies and the like. And you as public health folks partnering with groups like ours that work on some of these upstream advocacy issues. And if we do that, if we say, doesn't matter that we're in the middle of a crisis, doesn't matter that we're in the middle of a pandemic, and we say to ourselves, the public health system is an economic system, and our economic system is our public health system. And so when people are talking about, let's restart our economy, we can't, this is not a moment to restart our economy. This is a moment that we need to reset our economy. And I put a link there that shows, I wrote an op-ed that's in Progressive Magazine that talks about how we should reset rather than restart our economy. And you could Google, and we can send this email too, but you just Google Progressive Magazine and Calvin Gladney, reset, not restarted, pop up there as well. And it's been in a couple of like newspapers around the country. And so we got to think big and say, you know what, let's not try to go to the new normal. Let's not try to create a version of normal. Let's blow this up. And let's think about the entire economic system and how we can do things differently. And if we fix the economic system, that's going to start the fix of our public health system. And I would love to partner with any folks here for insurance companies and health systems and the like, because we got to think at a systems level. And I would love to partner and work with you guys on those issues. And let's use that mentality, going big, systems level change, to then get to a place where, like I said, Daniel Burnham, we're not making small plans. We're making the big plans. We're going for the systems level change to break that cycle of race, racism, public health disparities, and the equity issues that's tied to them. Let's take this time now to know that if we fight at a systems level, if we go for the big plans, the big ideas, we fight against the structure, that's the way we're going to win. That's the way we're going to break the cycle. And I would love to partner with you guys to do that. Thank you.
Wow, Calvin, that was a powerful presentation, man, and thank you so much for bringing the heat. I really appreciate the lack of public health nice. I think that's a message that we really needed going forward. And also, I think that your beard is coming in great. I think it looks wonderful. So keep that going. I think we've got a couple minutes. Does anybody have any questions for Calvin? Calvin, are you open to taking a couple questions?
I am. I'm just going to take a sip of water here and fire away.
Yeah, if anybody's got a question in the chat, please drop it. Or not in the chat if you want to drop it on the video.
I'll see if I can pop in this op-ed link into the chat box while we're
already popped it
seeing
in
if there's any questions.
Yeah.
Oh, somebody already did?
Yeah. Lots of positive,
Nice.
positive affirmations in the chat for you there, bud.
Well, thanks everybody. Hope you guys enjoyed that.
Oh, there's a question right there.
Well, let's see, John. Can you help me out since the chat is flying fast, and if you just want to throw out a question that you've seen?
So here's a question. What is one thing that you think a community coalition could work on right now?
A community coalition, or this larger Louisiana, your coalition?
I think a community coalition, so more of like a regional or local coalition. Like what's one of these silver bullet kind of PSE issues that we could work on?
Well, I think this intersection of changes in the transportation system and how we fund those transportation decisions has so many, if you want to call it, multi-solving and multidisciplinary positive effects, that working on that alone, if you wanted to have one thing and just say this is the only thing I can work on, that alone will have lots of domino effects. Wow. And here's the reason why. The current federal advocacy moment we're in, we hear a lot about all of the sort of stimulus and COVID-19 and the things we're going to do on a recessionary basis. But if you go back, what we did during the last recession is we said, well, how do we stimulate the economy? Well, we're going to come out with this stimulus package, and it's going to focus on infrastructure, and it's going to focus a lot on infrastructure spending, which really relates to and ended up being highway building. Yeah. And if you think about highway building and rebuilding, where are those communities that the highways get built in? And are those highways and are those new arterials built with green infrastructure and blue infrastructure and the types of things that could limit the air pollution that's sitting in those communities? Are they built with a complete streets philosophy? And right now we're in an advocacy moment to know that that next multi-trillion-dollar stimulus package, it might start talking about these things. And also the current moment, if we weren't in a pandemic and this is still happening, is the reauthorization of the transportation funding. People call it reauthorization. And every 6 years, we have to basically reauthorize that federal funding. And that federal funding directly will tell Sean Wilson, your Louisiana Department of Transportation head, what he can and can't spend money on. It will give him incentives to spend money in certain ways. So right now, the way it's set up is more money for highways, the state gets more money. And so I would say a community coalition can say, how do we advocate on a federal and state and local level to change these transportation infrastructure decisions and funding? Because those are the domino effects that end up with these health outcomes. And frankly, COVID-19, even if we get a vaccine tomorrow, isn't going to go anywhere immediately. And so a lot of these changes we're making that are short-term and sometimes long-term now to help this crisis, sort of opening streets, slowing streets, creating more public way usage for small businesses and restaurants, a lot of that's going to get funded by federal money or state money through your governor and then your head of DOT and those agency heads. So partnering organizations that can help you fight on those things, or we work on that research, I think is one thing, would be a silver bullet.
Yeah, and I think that really speaks to what you said earlier about us not just being public health officials or professionals, but interdisciplinary professionals. We really do have to become like closet city planners, I think, if that makes any sense. Just a couple more.
John, you got to come out of the
Yeah, we got to come out of the closet as some planners for sure. How and where do you see insurers and MCOs supporting that kind of work, specifically transportation, maybe?
You said insurers, and what was the acronym?
MCOs.
I'm not sure I know what that stands for.
I think medical care providers, probably.
Managed care organization that popped up.
Yeah.
Well, I think there's a number of ways. If you think about, if you go to Baltimore and you go to the John Hopkins Medical Campus, it sits right in the middle of East Baltimore. 19,000 people work there. So if you think about healthcare systems, major insurers, and managed care organizations, MCOs, they often run little small cities.
Right.
And those small cities have an infrastructure. So one, what are they doing to specifically think about the public health disparities within their population? What are they doing in terms of providing mobility alternatives for the tens of thousands of people that come to their little small healthcare system city on a daily basis? What are they doing to give them the alternatives? Maybe you don't have to drive. You can carpool. Maybe you can subsidize, micro mobility, scooters. They can help fund a bike lane infrastructure that gets you to both particularly communities of color, but also to their systems. They could fund and give grants, partnering with organizations like yours and mine, to do the research that get to these intersections, and they can back that and show that at systems level, as a healthcare system and as an MCO, they are funding and sponsoring the research to point out these disparities, so we have real data. Because a lot of times people don't believe these things and say, oh, it's anecdotal, that's not really true. And sometimes you actually need to show the data to prove the things we already actually know. So they can fund changing their built environment, they can fund working on their populations, and they can fund the types of fun research and analysis that get us to the system change that might happen at a city and state level, because they care as a system at a city and state level.
Wow. Yeah, I think that's powerful for sure. I think that in Louisiana, we've got Blue Cross Blue Shield and even our sponsor who's doing some phenomenal work on that. I think we've got time for one more question. How do we talk to, for lack of a better term here, it's in the chat, red state folks who believe that one group getting something means that another group is losing out? So, it seems that when we enact policies and programs that focus on African Americans, suddenly white Americans want things to be fair. So how can we as interdisciplinary professionals address that? Especially in rural Louisiana, where this is a big topic of conversation in city councils and policy meetings.
Well, this is where being interdisciplinary and intersectional can help. Part of it, though, I would say two things. One is, don't be public health nice, and we cannot go back to an all boats rise theory alone. We have to name and call these issues and say, unless we specifically address these issues that are based on race and income and class, we can't solve the problem. So that's one. Two would be, you can start to make fiscal arguments about these things and say, you know what, this is bad fiscal policy for your state. Whether you care about these communities or not, or you believe these disparities, here is the data, like Max showed in the very beginning, here is the data to show the public health cost of not creating solutions that relate to these communities of color. Here is the fiscal impact, the loss of revenues, as you lose small businesses, as you have these health costs. There's a negative, you're making bad fiscal decisions, irrespective of what you think about race and class and whether it's racism, whether any of these things are a myth. If you're thinking and you're saying, well, hey, I need to talk to a red state person, talk about the fiscal impact issues. That's where the research comes in, and you can show that if we just quantify the math, it's still bad decision making. So we got to go to certain parishes and spend disproportionate dollars in those places, not because we want to benefit those communities directly, if that's the sort of red state kind of issue, but it's bad fiscal policy for the state, for the city, for the parish, not to do those things.
Yeah, I think it's important that we know a lot of policymakers, whether they speak black or white or blue or red, all of them speak green, and money talks. So that's definitely a great thing. Well, Calvin, thank you so much for joining us, man. This has been really enlightening. I think there's a couple more questions in the chat if you want to stick around and answer them in the chat as we move on. If not, thanks so much. We owe you, man. This is great.
Hey, well, thanks everybody. I'll see if I can pop in on the chat, and then I guess back to work. I did put my Twitter and Instagram handle and email address, so people, let's reach out. John, we'll talk. Jamila as well, just to think about how we can partner and work on these things. Health systems, MCOs, then anybody who wants to partner with you and I, John, and work on these issues, I'm all for it. So, thanks everybody for listening. And I'll try to pop into the chat, but otherwise, have a good rest of the summit and take good care. Be safe.
Thanks, Calvin. We're looking forward to bringing you back to Louisiana soon. So,
yeah, looking forward to that.
Great, man. All right, well, we're moving on. Now I'd like to introduce the Bogalusa Strong team, Valerie, Vincent, and Jaime Bruins, and Taffy Morrison, who are going to talk to us a little bit about the role of PSCs in transforming a rural community, specifically with their work that they've done in Bogalusa with Bogalusa Strong. So Valerie, you want to take it away?
Sure. So Bogalusa Strong is an amazing partnership that we have. We've created to help further PSC changes in Bogalusa. We've been honored to work with such a passionate group of people who want to see change in their community. But just please note before we view this video that the video was shot and edited in early March of 2020. And we all know what happened. We had a huge change with the COVID crisis. So the video was shot prior to COVID-19. So that's why you will not see the current recommendations for social distancing and wearing of masks. But without further ado, please enjoy the Bogalusa Strong video.
Transform this community. Everyone has come together and working together to make policy, systems, and environmental changes here in Bogalusa.
Through Bogalusa Strong, it's made us truly stronger through just even knowing who does what in the community.
The impact that Bogalusa Strong Healthy Community Coalition has had in this community is not only the 30 projects that are currently being worked on by leaders in this community, but also by the residents who embraced it, taking it to their churches, taking it to the schools.
Some of the greatest impacts that I'm seeing are the environmental changes, because historically this community has been plagued with a lot of blight. So what we have been able to do is utilize community members, frontline people, students and parents, and we are seeing the ripple effects.
It's just brought us all together, and it doesn't matter what area you're in. We all come together, and we know who now at this time, which we didn't before. We've collaborated enough where we know if you have an alcohol problem, who handles those problems. We didn't have that before.
Bogalusa Strong has helped create awareness of behavioral and mental health services available here in Bogalusa. There have been several support groups created as a result of Bogalusa Strong, which also helps reduce the stigma of having a mental illness.
Bogalusa Strong has been an amazing support system that I didn't even know existed when we first started. In fact, I held a meeting trying to get people to say, hey, we should all come together and start collecting information about all the different services that are offered so we can get out to the community. I think that will help lift people up. And then someone said, have you heard of Bogalusa Strong? Oh, no. And so I went to a meeting and found, oh, they're already doing this. This is fantastic.
Now everybody knows where to go for services.
Bogalusa Strong, the LSU AgCenter, Well Ahead Louisiana, Our Lady of Angels Hospital, and also the City of Bogalusa, with many other community partners, have come together to form a Healthy Community Coalition to combat childhood obesity, physical inactivity, and other challenges that affect the community.
our children are enjoying going to the park and getting to be more active, and they're learning ways that they can be healthier. They're taking this knowledge that we are able to generate from our hospital and from LSU Ag and all of these various community partners. They're able to bring that home and become chain breakers, not only in their own families, but in their communities, in their school.
Bogalusa Strong has been a true asset to our community. We are coming together as one, different organizations, local leaders, trying to make a difference. Well, we are making a difference in our community.
For Bogalusa Strong, one of our many projects that are ongoing is our Painted Playground Stencil project. For this project, we're going out in the community. We're painting playground stencils that are low cost and effective to encourage physical activity.
Through SNAP-Ed's direct nutrition education, we provide hands-on nutrition education that includes food demos and physical activity for our residents.
All those things are happening in conjunction together with the over 80 to 100 partners that are doing this absolutely every day.
Bogalusa Strong has made Bogalusa stronger, and it's increased the volunteerism as a whole overall, and the enthusiasm from the community volunteering all the way to the impact of our monthly meetings. We have 70 people. That's unheard of. We have people involved enough and care enough about our city to come out and do more for us.
And so it's been a great outlet to get new ideas about how to approach our program and how to grow it, as well as just encouragement from other folks who are trying to do the same thing, that we're all have the same mindset of uplifting the community.
It's about unity. We stand for unity and making our community a better place.
And us coming together and becoming one has made us stronger.
Bogalusa Strong, creating a healthier community together where all people thrive.
Hi, everyone. Can you hear me?
We can, yeah.
Okay. This is Jaime Bruins, Cyprian. I'm with Louisiana Campaign for Tobacco-Free Living with the Healthier Air for All Coalition, the Healthier Air for All campaign. And policy systems and environmental change approaches seek to go beyond individual programs and effect change in the structures in which we work, live, and we play. And so the Healthier Air for All statewide campaign educates on the dangers of secondhand smoke and encourages support for smoke-free policies to protect all employees from the dangers of secondhand smoke in the workplace. And this includes bar employees, gaming employees, and entertainers. And so what I will do briefly is discuss the role of the smoke-free policy, the role it played in supporting the efforts that culminated in what is known today as Bogalusa Strong. So prior to Bogalusa Strong as an entity, there were also other coalitions in the area, one of which was called the Washington Parish Coalition on Human Services. I served on this coalition along with Councilmember Gloria Cates and others. Councilmember Cates became the council champion for smoke-free Bogalusa. They passed a policy that protected all individuals from secondhand smoke. And so before the policy went into place, what happened, we attended in-person coalition meetings. We had meetings by phone. We visited areas that were smoky venues that would be affected. And we actually sat down and talked to them about what was going on, what the policy entailed, and what would be happening. And so we also held an awareness event with musicians who supported the smoke-free movement. We met with the police department. We created information packets for businesses about what's going on. So the point of it is it needs a group of people. A policy does not go forth with just one person. We need participation. And so during the council meeting when the ordinance was presented, not only were adult voices heard, there were also the Defy Youth group that testified very confidently before the council. And one of the members actually was going to vote no for this policy. but because he heard these youth. So we should not forget about the youth when we're doing these policies and these systems changes. It passed unanimously after that youth testified. So the ordinance was implemented in July 2017. And so you will hear about other health initiatives with Bogalusa and with Bogalusa Strong that are going on to create sustainable changes. And these changes will have impacts for years to come. Bogalusa was actually the ninth municipality in the state to pass the smoke-free ordinance that covers the bar, the venues, the gaming venues. So now we have 29. So they were in the head at number 9. So, and each year during the month of July, Bogalusa Strong promotes smoking cessation services to support those who want to quit. And so policies such as this comprehensive smoke-free policy is important for making changes at the legislative level, also at the organization level. And Taffy Morrison will discuss more about what change looks like at the systems level.
Thank you, Jaime, so much for that. My name is Taffy Morrison. I am the Healthy Communities statewide coach for Well Ahead, Louisiana. And the city of Bogalusa was ready for community change by passing of that smoke-free ordinance. Systematic change was enabled through the readiness and the leverage of active involvement of the endorsed support of elected city and legislative leaders with an outstanding foundational partnerships of Our Lady of Angels, LSU Ag, and Well Ahead. The difference between cities who make true systematic available changes is leadership investment and engagement. People have been trying to do this for decades in this area, but at the right time, with the right leaders, having the courage to trust coalition leaders, giving them the freedom to connect to the gaps, connect the dots, fill those gaps up, leverage the change, and was a crucial first step. Creating the Mayor's Wellness Council and Executive Committee, in addition to empowering community members and champions, has been key. But all of this happening still left islands of silos and access for the city. So launching the Bogalusa Healthy Community Coalition identified these gaps, empowered people, and connected the dots by bringing the city, state, regional, and local partners all together to begin addressing the sea of needs that was in the area, like addiction, obesity, poverty, chronic health conditions, and the barriers to good health. Taking the education from action to accessibility, giving residents not only the why, but now the how to make it happen. This created a partnership relationships, building the bridge for change. Some systematic changes achieved have been creating a systematic approach for accessing community resources by developing a comprehensive community resource directory to include behavioral health, substance abuse, healthcare, health education, crisis intervention, physical activity opportunities, healthy eating opportunities, homelessness, 211 resources, and Well Ahead resources. A Well Ahead mini grant created a city's webpage for a one-stop shop for these resources. Now leaders, clinics, physicians, social service agencies, nonprofits, churches, community members have access. This access changed also how the city responded to COVID-19. A homeless committee was formed, creating a systematic referral and resource system. Coalition partners worked together to provide computers and printers for a new community center in a low-income neighborhood. So students without computers or internet who are receiving zeros on schoolwork now complete this work and are improving their academic success. Adults utilize it for submitting job applications and applying for basic support needs, receiving case management as well. Knowing that the need to connect with churches and pastors was essential, this took shape when Bogalusa Strong partners wrote letters of support for an awarded Bogalusa Heart Study Health Ministry grant, culminating right before COVID-19. When COVID-19 hit, we had already set up initial meetings and had a first health fair, which laid the foundation for trust and also credibility. You know, these efforts quickly, when COVID-19 hit, reached out to 60 parish ministers who joined weekly calls with city and parish leaders and physicians, all working together through the crisis, all all sharing and even sharing the expanded resource guide and prevention education with their members when they called them weekly. This has now evolved into a ministerial alliance and expanded health ministry opportunities. So bridging of networks of community partners, leaders, health professionals, and faith-based leaders have created the help that the people can get from the need to the resources and education to make systematic change in this community. So we are so grateful for all these partners who have worked so hard on this and been so successful in it. So I'm going to pass it over to Valerie, who's going to share about the environmental change that's been achieved.
Thank you, Taffy. So big thank you to Taffy and Jaime. We have all worked together for many years on the LHCC Region 9 and also on Bogalusa Strong. In working to make the healthy choice the easy choice, as we always say, the LSU AgCenter works in healthy communities and policy system and environmental changes in the communities across Louisiana. As we heard from Jaime and Taffy, it takes PSE changes to create change in communities. So in Bogalusa, the healthy community work that was ongoing in Bogalusa was really strengthened by the Bogalusa Strong partnership. So we had a lot of programs, we had some PSE work going on, but we really needed to bring it together and really formalize it into Bogalusa Strong. For the LSU AgCenter's part, the LSU AgCenter and the SNAP-Ed program utilized resources to make environmental changes, and these changes were enhanced through partnerships with the City of Bogalusa's Rec Department. So I want to thank Landon Timms. He's been an amazing partner. I think we all know when we're working on environmental changes, getting with the rec departments right away and making sure that they are supportive of what you are doing can make a huge difference. LHCC mini grants were also vital in us making environmental changes, as well as foundational grants and well ahead funding. The funding and support provided through partnerships allowed us to really expand the current base that we had through Our Lady of Angels and the LSU AgCenter and the Y and several other places, and to expand those community resources in Bogalusa. We also had previously partnered with the schools so that each school had a garden. The LHCC mini grants allowed us to help expand these gardens, and we've also been able to expand to community centers and community sites as well. As for environmental changes with the gardens, it's so easy to put in a garden, but we really want to make sure that we have something that's sustainable there. So training volunteers, getting our youth on board, getting our adults on board. And something we did a little differently in Bogalusa was that we utilized our LSU AgCenter Master Gardeners, but also utilized really the community and the community resource base. Each sign up for different days when they would work in the garden and they would support that garden. We do field trips to the pharmacy that we have, and when I say pharmacy, I mean farm. Let's see, one of the pharmacies. And the gardens allow for healthy food access. Nutrition education is also provided by the LSU AgCenter SNAP-Ed program. And we have a great partnership with Our Lady of Angels Hospital. And they also come out and support us. We also have an alliance with the local physicians that we work with. It allows residents to learn the basics of home gardening as well. For the LSU AgCenter SNAP-Ed Stock Healthy, Shop Healthy program. So this is a wonderful program that you may have in your community through the LSU AgCenter, but basically what it is you're going out into the community at a market, and in Bogalusa we chose Travis's Market. So Travis's Market is our local corner market that residents of Bogalusa tend to frequent. And Christine Mitchell, our SNAP educator, work with Travis's and the amazing store staff that they have there. And we were utilizing the Stock Healthy, Shop Healthy items, which consist of shelf talkers, so things that we actually put on the shelf to educate the clients about whole grains or different types of foods. We also utilize replacements, redoing the placement of healthy items in the store. So we know things at eye level we tend to buy, we tend to look at those things at eye level. So they worked with us on repositioning things in the store to put those healthy items, at eye level. We also have a healthy checkout that we're working on there. And also repackaging of healthy food items. So previously to this, previously to Bogalusa Strong and LSU AgCenter being involved with Travis's, there was a typical lunch order for people in the area. And they would call in and order a lunch from Travis's, and it used to consist of a sandwich with white bread, chips, and a soda, okay? And then after working with us, working with the coalition, they actually now made changes. So now they offer a sandwich with whole wheat option for bread, which is great, water, and a fruit cup. So you can actually get that same lunch bundle and have the changes be made. So that is indeed actually a system change. However, it came about because of the environmental changes that were made in the store. The other things we're doing in Bogalusa are amazing. We are doing a Shop with the Doc program. So a lot of you know that LSU AgCenter has store tours that they're doing through SNAP-Ed. We've expanded that to work with our local physician network, and we're now shopping with the doc, which is great. We have the playground stencils that you saw in the video. We have 70 to date, and we have several more that were listed prior to COVID. So we'll be back working on that. Park revitalization, and actually the circuit training and playground stencils. Our citywide messaging campaigns to really get the message out there to support that the healthy choice can be the easy choice. So if you go into the store and you go in the freezer section and you're going to buy a frozen pie or something, you actually go to that freezer section, and on that door there's a nice SNAP-Ed message that says, eat more fruits and vegetables. So we're getting, those signage out and the messages out everywhere you go in town. As far as the Parks Alive program, through Bogalusa Strong, our City Councilwoman Keys, actually became a subcommittee lead. And she now leads a subcommittee for park revitalization along with Land and Thames. So through the park revitalization, we're adding little libraries in the park, the story walk, bike racks, no smoking signs, the AgCenter SNAP-Ed promotion of physical activity signs, distance signs, outdoor fitness equipment being added, motivational signs, new benches, picnic tables, exercise station, and then also some things for special needs children as well. We are continuing our pharmacy community garden and working with that. And also the city of Bogalusa is working on the bike and pedestrian path. So through that bike and pedestrian path and the master plan, the city's gonna be utilizing the DOTD state road transfer credit, which has been approved for 2022. We also have several citywide wellness challenges coming up. Shop with the Doc, at Temple Park, and our healthy restaurant menu initiative as well in 2020 that we're excited about. But as we look at environmental changes, I really challenge you to look to make policy and system changes to really help support and maintain sustainable changes in the community. When we look at what people are calling a new normal and what does that look like, I really want to challenge everyone to make changes, work together. Who's missing from the conversation? If you're only working with a healthy community group because your employer told you that it was a requirement, or maybe that it make your organization look good, ask yourself, what changes can you make? If you're already spending time at a monthly coalition meeting each month and only using it maybe for networking, ask the facilitators and the coalition leads, what areas of the needs do the coalition have? Don't be afraid to change the narrative, add people to the table, and don't be afraid to listen and make changes. Use the current crisis as a way to change the conversation and add PSC changes in your community. Thank you.
Guys, that was great. Thank you so much. I think we actually ran out of time for questions right now, but if you do have questions for the panelists, you can drop them in the chat. And Valerie, Taffy, Jaime, are you guys comfortable answering those questions in the chat as we move through? Perfect. That's a thumbs up. Sure. All right. Well, now it's my pleasure to introduce Miss Mayor Wendy Perrette. She is the mayor of the city of Bogalusa. And I just have a huge amount of admiration for this lady. She's such a cool person. Mayor Wendy, welcome. Thanks for joining us. Are you on? Do we have you?
I'm here. Thanks, John.
Oh, fantastic. Well, I think we've got some questions for you. Thanks for joining us as a panelist here. I know that we were going to have Representative White on as well, but I think that she is in a special session right now. How have you utilized the LHCC coalition specifically to mitigate health and community concerns in your city?
Well, teamwork has taken place greatly in our city, and teamwork's definition is a collaboration of an effort of a group to achieve a common goal or to complete a task in its most efficient and effective way. And this is the definition of the unselfish nature of our amazing Bogalusa Strong partners who are working together to mitigate health and community concerns within our city. We've community partnered with Our Lady of the Angels Hospital, Well Ahead, LSU Ag, and we've been working in the area of healthy communities and when they approached me about joining forces, I was unsure about what it meant and how it would help our community. And we began to work together and we formed an executive committee. And the priority was to find out what needs did the residents feel were critical in Bogalusa to tackle the community concerns. We held a community forum. It was facilitated by LSU Ag. And we listened to the community, and this was vital to our success. We weren't out in the community doing what we thought the community needed, but rather working together with the residents and community partners on what they told us their needs were. And we were armed with the findings that we got from the initial community forum with Our Lady of the Angels Hospital community health needs assessment data that we gathered. Our parish and our regional health ranking, we've been working together to make real and sustainable changes to address residents' concerns and identified needs in Bogalusa. We've gone from over 75 to 100 active partners this year, and our approach for Bogalusa Strong has been far-reaching, and we've been using CDC's guidelines, community model, and utilizing our formation of Mayor's Wellness Council. And as recommended by Well Ahead, we meet 3 times a year. And our advisory committee, we formed Bogalusa Strong Healthy Community Coalition. We formed focus groups. And I have to refer back to my notes on my focus groups because they are breaking barriers to healthy eating, get moving, be healthy, and behavioral and emotional health committees were established to engage the community to make policy, system, and environmental changes in Bogalusa. There's many things that have been accomplished with this. For one thing, unity has taken place. We've come together. We know what everyone's doing now where we didn't know before. We've had community resources and assets for our city's website, which was important. We have a community resource guide now to include behavioral health, drug addiction, healthcare, homeless, food resources, crisis intervention, just you name it, we have it. And I know we've mentioned the stencils. We've done that in our local parks to increase physical activity. That was funded through LHCC and Well Ahead and LSU Ag. Well Ahead has funded a citywide walk audit, and this led us to moving forward with securing some funding that we were in the middle of DOT trade-off there, and to get some crosswalks and things of that nature in place for our road project, for the road transfer. All the neighborhood parks, we've been working in those and bringing them up to date, and whether it be swings or stencils, the smallest increased physical activity. We've started in 3 years, we've had a marathon where which kicks off Walk with the Doc at Our Lady of the Angels Hospital, and the mayor, I encourage everyone to come out, and we walk from Goodyear Park to Cassidy Park, and there's new nutrition education, and it goes over the YMCA, and all in conjunction with it. They have weekend backpack programs where we've been able to secure backpacks for individuals who are homeless or insecure students to have a healthy, shelf-stable food to take home and eat on the weekends. There's been, of course, that we've mentioned the pharmacy of the garden, our community gardens, funding for increasing healthy behaviors among cancer survivors has been really big, and I've been impressed by that. We've had due to COVID-19, weren't able to have the fashion show that was planned, but I believe that we'll have it in the future. They had a tutu trot in the Cassidy Park, and all of these things. So these ladies have stepped out. They wanted this. The community wanted it. We just didn't know how to bring it all together. And that's where Bogalusa Strong comes in, and Taffy, Well Ahead, LHCC, LSU Ag, these partnerships, Our Lady of the Angels Hospital, we didn't have those. You all provided us the dots. You've helped connect the dots for us. We needed it. The community wanted this, and we embraced it a lot easier than thought. There was some resistance to community gardens before that that completely changed after it was presented in this way. And there's so many positive things that has bridged the gap in our community. Bogalusa Strong Community Coalition has increased, and we have more providers, partners, and agencies in our community. And when COVID-19 crisis began, we were able to quickly get together and provide a crisis response. We were able to do a resource guide because we had already started. We had a jump start on the thing. We started a city website page for COVID-19. This allows the community to go to a one-stop shop too, to find out what's going on in the community. What are these things with COVID-19? It's a 16-page resource guide, and I was also able to quickly establish a COVID-19 community spotlight radio show. Had a little hobby of radio in the past, and a friend of mine has a radio station locally here, and he gave me the keys to it and said, have at it. So on the 13th of March, we were able to close City Hall down, and March 16th, we were on the air live and giving the COVID numbers and the latest from CDC and giving local individuals, our local community, what's going on. And through it was, we were able to do this. Many people don't have internet here out in the parish. Rural broadband tends to be an issue, and we were able to go to the airwaves. We also use that for Facebook. We partnered with Bogalusa Strong, Our Lady of the Angels Hospital, Well Ahead, and many elected officials, medical staff, professionals, and this show has been a success. We were doing it daily. We went to 3 days, and then we're down to 2 days a week. And next week we will transition. Since the governor's new orders are to move into phase 2, we're transitioning the radio show to 2 times a week, weekly format, and we're looking at doing that weekly, and that will be a Washington Parish Community Connection resource education radio show and Facebook series with partners with Our Lady of the Angels Hospital, and they'll host a Top of the Dot radio show and a Facebook series to address the health in our community. This radio show will be, I believe it will become a sustainable platform for Bogalusa Strong and Washington Parish partners to continue to provide information for our community. It's been a great way people can call in and interact with those that are on there. And I think that's positive because people like to know even the littlest questions, and it makes them feel comfortable. And I think it's good for everyone to be able to, as an elected official, I think it's important to be accessible. We were also able to strong meetings from online and offer call-in options. And at first COVID-19, Bogalusa Strong online meetings, we only had 71 partners and residents to attend, and Bogalusa Strong supported all the other meetings as well. The Parish Minister Alliance, it's not just because our ministers are forefront and leaders in our community, and we've been able to utilize them and Bogalusa Strong and creating a ministerial alliance. And through the establishment and continuation of Bogalusa Strong, we have been able to tackle and mitigate community and health concerns. And I just feel so fortunate to have such a wonderful group of men and women to work with and collaborate with. And again, our community was ready for this, and we just didn't know how ready we were. And so we were blessed with Well Ahead coming to town and showing us how to put this together. I believe this is something that'll last for years to come. I'm very thankful to have been approached by this and not turn this opportunity down, and I feel very welcome. So I look forward for Bogalusa, and not just the state, but working with Bogalusa and its individuals throughout.
Well, Mayor Wendy, thank you so much for joining us. We're having some technical issues hearing you, but we're also out of time. Would you be open to sticking around if anybody had any questions in the chat for you? Could you answer?
Absolutely, I'll be here.
Great. Thank you so much for joining us. And I can't wait to come back to Bogalusa. I think I still owe you a margarita from the last
time. I do believe you owe me.
Well, it was great seeing you. Thanks again for joining us. So moving on, now we're going to talk with Miss Tonia. Tonia Moore is the, let me pull your, so I want to make sure that I get this right. Tonia is the Director of Tobacco Prevention and Control at LPHI and the lead for the Louisiana Campaign for Tobacco-Free Living, TFL, and Healthier Air for All. Tonia, welcome. Thanks for joining us, and why don't you take it away?
All right. Thank you, John, and good afternoon, everyone. I tell you what, I would love to see some of your beautiful faces that are out there. We have almost 100 people gathered, and one of the things that post-COVID we're not able to touch, but at least we could see each other. And thank you. Look, oh, beautiful. Hi, everyone. And I tell you what, in the realm of the Louisiana Healthy Coalition, I tell you what, Ms. Amy Blaylock, I don't know you, but moving forward, you win the Healthy Meeting Award because you on the treadmill and doing a meeting. So I have learned something from you, and you probably didn't realize it. So thank you all. Great to see you. Happy June. Yes, it's June. We're already in June. And however, as you see the title of the slide, Opportunities for Policy Approaches Post-COVID-19, we still have a lot of work to do within the communities. And I tell you what, just listening to all of the great work, the stories that have been captured through video and other testimonials, this is really enlightening. I mean, you guys have done some great work out there in the communities as teamwork, partnerships, and other collaborative ways to get things done. Next. I'm going to talk about just about 3 things, looking at policy efforts before COVID-19, after COVID-19, and then how can we creatively and innovative keep the momentum going. Next. All right, next. And so before COVID-19 policy and advocacy, as you see here, these are some images of how we do like to have face-to-face interaction. We love events. We like social gatherings. You know, we're a very shake hands, hug community. And so those are some of the things that we miss. And so here I captured the ham and smoke-free ordinance, the strawberry festival, having dinners, cocktails even, may not be healthy, but you know, and also rallies, youth events, celebrations of the work that we have been able to do. And so naturally, that's how we build trust and get to know each other through these events, having camaraderie in the communities. Next. So here are just some of the traditional policy and advocacy that we did. Now we're saying pre-COVID days. So some of these will always remain the same. So deciding on issues, we've heard tobacco use, we've heard healthy communities, healthy parks, recreation, and making sure food choices are available, and not just that, but educating communities on what actually is healthy food. And so again, some of the buzzwords: creating a coalition, going to coalition meetings, strategizing on plans of actions, hosting the advocacy trainings. I know we had some planned that did not go according to plan. Also meeting with policy and decision makers to understand their stance. Very key, and we're going to talk about that. And also just getting together to talk about executing plans, and then celebrating and re-energizing and having post wrap-up meetings to talk about do's and don'ts, outcomes, and lessons learned from those. Next. So what is happening post-COVID-19 with policy and advocacy? As you go to the next slide, I want to talk about two examples that we're facing right now. So one, the Louisiana legislature is still meeting. This has limited our capacity to go and have advocacy days, to physically be in the presence, to testify in front of committee meetings and hearings, to talk about our stance on different issues. And not only that, I'm appointed to Shreveport. There is a smoke-free Shreveport ordinance that is in play right now as we speak. Next Tuesday, June 9th, the council is going to consider that measure. So how do you actually do this when you can't be there physically and they're having Zoom meetings? So some of the challenges is that no in-person interaction. You can't get a feel on how a person is thinking or how their energy about a certain issue, especially body language, eye contact. That's important. And then also some policymakers are definitely not trusting of various forms of technology with that off the record comments that are usually said, hey, is this off the record or off the record? Let me share something with you. And in Louisiana, knowing our laws, you're never really off the record. And then also the social engagement, having the festivals, the events, the chamber events, where we're connecting with other folks who have connections to the connectors to actually support and maybe influence some of the work that we do. And then not only that, some of the municipal and state protocols are just not conducive for community input. We are definitely learning that with the Shreveport ordinance because you cannot, and when you don't speak, you don't hear the passion, you don't hear that energy coming from the actual person. Someone is actually reading that actual letter. So it diminishes a lot about just the political process in whole. However, there are opportunities for us to really get creative here, and we just have to be flexible and adapt, which we have been. But how do we get creative, right? You know, we've created all kind of hashtags and images. We've started to lean on digital media, and one of the things is also hosting events like this, interactive virtual advocacy events that we probably should host more of. Video chat with coalition members to strategize. I know I've sat on several of those. And also creating online advocacy campaigns. I think that's key for now when we're doing our budgets for next fiscal year, that we put extra dollars in there to boost up our technology realm. And also we all probably should be taking some classes on how to use it. And also just utilizing the strength of coalition members. You guys have a lot of knowledge, depth, and network within your communities or around the issues that you represent. Next. And so here, we'll take about 30 seconds in the chat box. I want to be interactive. Put in there, how can we creatively and innovatively advocate during our quote unquote new normal? It may be normal for you, but it's not normal yet. It hadn't sunk in. So if you will, take a few minutes and maybe add some ideas on how we can creatively and innovatively advocate during our new normal times. And Jaime from our organization is going to capture some of that information, and we would appreciate your feedback. And we'll also use some of this to also disseminate as a post wrap up from this meeting. Next. Go ahead and keep putting your ideas in there as they come to you. So when we talk about engagement, really virtual at this point, as we're going through the various phases in the state, some things to consider is definitely your audience, because there is no one-size-fits-all approach. And when I say that, we have a lot of challenges that we are actually trying to overcome and we're still learning about. I'm gonna throw this number out there. 260,000, remember that. 260,000 Louisiana residents do not have internet, Wi-Fi access availability, or capabilities. So everything may not be able to work virtually. And so those are some of as we're developing toolkits, as we're doing advocacy in communities, we have to, again, put in that chat box, how do we creatively reach them? Age, that's another consideration. We have youth advocacy work going on. You may target them one way. Parents and folks in my parents' age group, you know, they're just getting on Facebook. COVID forced them. My dad's a pastor, and guess what? He said at first Facebook was the devil. Now he's preaching on Facebook to his church members. It's interesting how times, situations, and events will cause you to create the way you typically roll and roll out something different. Interesting. And I still can't believe it. And then also, we can also share information, assist communities in the reopening of businesses right now. You know, a lot of us have been sharing it, and a lot of you are on task force in communities to talk about how to reopen and open these businesses smoke-free. So again, just thinking outside the box, reinforce with everyone here, reinforce with coalition members, the media, policymakers about your ultimate call to action. At the end of the day, we have a purpose and reason why we're doing these and why we took these issues up. Call to action is key. And so as I leave you with those last parting words, I just say keep up the good work. We're in the process, TFL, of developing virtual advocacy virtual toolkits. And when those are complete, we're going to share them with all the members of the coalition. Thank you guys, and thank you for your attention. And you are all beautiful. Thank you.
Thank you, Tonia. That was great. And thank you for all the hard work that you're doing throughout the whole state. I think the TFL is doing some phenomenal work, and good luck with the fight in Shreveport. I'm also inclined to believe with your dad there that Facebook sometimes can be the devil. While yes, a useful tool, you know, you got to stay out of those comments sometimes. All right, well, now we're going to move on. It's my pleasure to introduce my good friend, Ashley Hebert. She's the Government Relations Director for in Louisiana for the American Heart Association. Ashley, why don't you take it away?
Hi guys, thank you so much for including me in today. Today, like Tonia, I also get to discuss policy initiatives at the state and local level post-COVID. I don't even know what that looks like. I know a lot of us have no idea what that will look like right now. At the American Heart Association, we understand that it's easy to think about reducing cardiovascular disease in the clinical setting, but that's not easy for each individual to get to that place. You guys know social determinants of health are those non-clinical factors that have a huge factor on your health. I know we've heard so much about social determinants in the last month and a half, and I'm really glad that I get to dig into that part of my job a little bit more. Next slide. So, I don't know if you know this, but only 20% of your health is determined by actual genetics or clinical care. Social determinants are those health shows that health and illness are not random. These are not random anomalies through human society. Everything is interconnected. Health and illness are the result of clusters of social, environment, and interpersonal forces. Knowing that, how did the social determinants become my passion? We were, as an organization, we picked a book to read together, and we read the book Evicted. Hold on. Right here. We read the book Evicted maybe 2-3 years ago. This is from 2016. It's by Matthew Desmond. It's set in one of the poorest neighborhoods in Milwaukee during the 2008 financial crisis, and it follows 8 families that are struggling to pay their rents during this financial crisis. It's a really great read. I learned a lot, and it really had a profound effect on me and the work of the Heart Association. The book highlights extreme poverty and affordable housing and economic exploitation. And although it focuses on evictions at this macro level, the author uses eviction as a lens for inequity. And I know you guys have heard so much about this as we're going through COVID together, how this pandemic has really exacerbated the health disparity that we have here in Louisiana. So we read this book, and our charge was, how do we use what we learned in advocacy? Like, what do we do? Like, I don't want to have a meeting just to have a meeting. I don't want to form a committee just to have a committee. And I definitely don't want to read something that I'm not going to put into practice. So I was really glad that, this was able to, kickstart the social determinant side of my work. Since reading the book, the Heart Association gave me another title. I am our social determinants of health national staff person when it comes to developing our policies, editing our policies, editing our goal wins to, affect inequities. How are we dealing with what we learned? All our policies, we want to be deeply rooted in equity. And that's definitely something we weren't doing until the last 2 to 3 years. Next slide. So as an organization, we are now looking at these 4 pillars. I know this is a ton of words on the slide, but I'm going to read them. First and foremost, we have to develop sensitivity to the effects of poverty and racial and ethnic bias on our patients' lives and on their health behaviors. As an organization, we have to build mechanisms for recording health-relevant socioeconomic data in routine patient care and include those socioeconomic variables when we're talking about why people are dying and how they're dying. We all know as a whole, the healthcare system can't do it all itself, but we can't expect it to solve all of the social and economic problems that contribute to poor health. We need partnership, just like Valerie said earlier. Look at these partnerships. It can come from anywhere. You never know who's doing the same work that you're doing. And finally, healthcare practitioners and their professional organizations should advocate for population-level policies that mitigate the effects of the social determinants of health. So with that, Heart Association, we find it very important to identify and address social determinants. And with that, implementing evidence-based policies that advance equity help ensure that all people have the opportunity for long, healthful lives. If we are not advancing equity or making that the focus of all of our policies, we aren't doing anything. The overall population cannot improve if portions of the population are not benefiting from improvements in prevention and treatment. When we pass a smoke-free policy, for example, Tonia, we have a smoke-free Shreveport going to vote next week. Right now, it's not a model policy by any of our organization standards. Tonia's shaking her head like, yes, yes. It's kind of, it's interesting. Smoke-Free Shreveport excludes gaming facilities in the ordinance. Without all looking stunned, you guys know that many people that work in the gaming and hospitality industry look just like me and look just like Tonia. So if we're going to exclude a certain portion of the population, how are we improving anything at all? Like I said, overall population can't improve if everyone doesn't improve. So, you know, that ordinance in Shreveport is a bit of a problem, and I know it keeps me and Tonia up at night, and we're going to try to bust our butts to improve that. But that's just one example. So you can go to the next slide. I'm sorry, I'm talking over the next slide already. So by enacting policies that address social determinants of health, we already have tons of scientific evidence that shows policy interventions, even small ones, of the social determinants of health improve that overall population health and can reduce disparity. And many policy interventions have the power to have ripple effects across multiple social determinants, which is very cool. For example, if you're doing an affordable housing intervention that moves families into moves families from lower poverty neighborhoods into maybe access to better educational opportunities in neighborhoods, you're improving more than one social determinant. It's just really important to understand and identify, you know, what you identify these determinants at the community level, not even just the state level. A lot of you guys have heard me say, if you work with me before, local leads the way. And that's definitely the approach we take with our smoke-free efforts. It's a lot of the approaches that we take with the Heart Association. People think it's so easy to pass a state bill, and it's definitely not. Some other policies that we're working right now, specifically in New Orleans and statewide, is a healthy restaurant kids meal bill. So this policy makes milk, water, or juice the default beverage in all restaurant kids meals. Why is this important? If you look at the underlying health conditions from African Americans that died from COVID-19, what were they? What were they? Obesity, diabetes, and cardiovascular disease. If we can pass a policy that will make a small turn on the dial when it comes to addressing those underlying health conditions, we're doing something. You know, by making milk, water, and juice the 100% juice, the default beverage, instead of the sugary drink, we are lowering sugar consumption. If you didn't know, sugary drinks are the leading cause of added sugar in the American diet. And next time you're driving through your neighborhood, look how many fast food restaurants you have compared to some other neighborhoods. I live in New Orleans, so I see this all the time. There are a lot more fast food restaurants and no grocery stores. Dollar General is not a grocery store at all. So they already have reduced access to healthy food, and they're plugging it in with whatever they can get at a fast food restaurant. This is a bill that we feel really strongly about. We were hoping to get it passed during the regular session. It doesn't fit the call for the special session, but I'm gonna punt it over to Rika Triggs, my colleague, who's also on the call. She's our community advocacy director in New Orleans. She's also working the same policy with Mayor Cantrell right now too. So it's kind of like first to the finish line wins there, but I do appreciate her support there backing me up. Another policy that we have worked on was preemption. The Heart Association is against preemption on any level. What is preemption? Preemption is when a higher form of government blocks a lower form of government from passing a policy. for example, minimum wage. Louisiana doesn't have a state minimum wage, so we default to the federal wage. Local governments in Louisiana don't even have the power to set a wage, even if they wanted to. State law prohibits them from doing that. I'm very honored to say that the Heart Association is moving in some of these circles, some of these lanes that you would not expect to see the Heart Association in. But we worked a minimum wage preemption bill that would allow local governments like New Orleans, like Shreveport, like Lafayette, giving them the power to set the wage, whatever they felt the wage would be. And we got a lot of pushback. I was told I was diluting the message, the mission of the American Heart Association by working a preemption bill. But this is our mission. Our mission is to be a relentless force for all lives. And that is what we're supposed to do by reaching those that don't have a voice. And that, again, that's people that look like me, it's people that look like Tonia. My word of advice to you guys when it comes to working on policy initiatives post-COVID, you should always, you're gonna get pushback, but don't be afraid. Don't let someone tell you that you or your organization does not belong in a space when you know that you're supposed to be there. You know you're working on equity and giving people that don't have a voice power when it comes to their health. Most definitely, let me know if you guys have any questions, comments, concerns. I'm here for you guys, and thank you so much for letting me be a part. In the meantime, Tonia and I will be crying and drinking about Shreveport, so we'd appreciate your prayers.
Ashley, thanks so much. You definitely, you got my prayers, and I'll pour a little bit out on the ground for you too.
Thank you.
Thanks so much for joining us. That's it, guys. I think the big takeaways for me for this Soul Summit were, just three things. What Ashley said, local really does lead the way, and really putting an emphasis on the work that we do on the local and regional level. We need to be interdisciplinary professionals, not just public health professionals, but interdisciplinary professionals, like Calvin said. And let's stop being public health nice. It's too, things right now are too important for us to be nice about it. So let's stop being public health nice. I want to take a minute to thank our planning team in Region 9, Jaime, Valerie, Taffy, Michelle, Mac, Laura, Jamila, like everybody, you guys crushed it. This is such a cool thing. To manage a summit like this is a thing in and of itself, but then to change things to an online platform and still execute it flawlessly. I'm so proud of you guys, and thanks so much. I also want to thank our sponsor, Louisiana Healthcare Connections. Brian, thank you so much for making this happen as well. We're going to take a moment. We're going to take about 5 minutes to break. I'm going to go get a little bit of something to eat. And then if you want to stick around, Dr. Jennifer Redman Knight is going to present about some change management things, a change management workshop. And Michelle is going to drop a PDF of a worksheet in the chat if you all want to open that up before Jennifer gets started. And Jennifer will get you set up with your credentials and get you going. But thank you guys so much for joining us. I know it's a thing to sit here for this long, and we really, really appreciate you. So thank you very much. All right, it is 2:15. I know that I got a little bit of a stretch in and had a little snack. I hope you all did as well. Jennifer, I see that you're on. I think are you able to share screen?
Not yet, because y'all are still sharing. So if you stop sharing, I can start sharing. Oh, your poor screen.
No, I don't know what's going on. We're working on it.
Here, hopefully mine won't do that, but it could happen too. So we'll see.
It's good so far.
Yeah. So I don't know I guess some folks know me, but some folks may not. I'll let you guys make sure you download this that was in that chat to it'll be something you can use today as well as after today. So just a heads up there, and I'll move this to slideshow, and then John, if you want to briefly introduce me, cool, or I can introduce myself, either one.
No, I mean, I think we can both do it. So Dr. Jennifer Redman Knight is a public health professional, but also an expert in meeting facilitation and change management and leadership. And she has been doing an ongoing series with our local and regional leadership throughout the state, just teaching us change management tactics, how to better respond to the changing conditions in the world as leaders, and also how to facilitate meetings in an online realm. Obviously with COVID, we can't meet in person, so things have had to change. And Jennifer's given us some great tips about how to do that. And Jennifer, go ahead and take it away and introduce yourself even further if there's anything I missed.
No, I think that's great. Thank you guys for having me again. Some of you guys are like, you got her again, and others of you may be like, who is this girl? And so I'm glad to be here, and hope that this content will be helpful for you as we kind of move through the end of your day. And I recognized when I saw this, I was like, I'm the end of a 3-hour webinar. Holy smokes. This is big. This is big. So totally, if you need to take a dance break, if you need to keep breaking or eating, go for it. My last meeting that I had before this, I was eating while I was in the meeting. So please eat away. If you want to type in the chat your most interesting food that you're getting to enjoy right now, please do. Your favorite snack at the moment. Kind of remind us. But for those who participated in the last training, I talked a little bit about change management and how it relates